Well, this morning we are talking what's going around. We're joined here by Dr. Scott Burkhart, joining us here from Tallahassee Orthopedic Clinic, because we're talking high school sports right around the corner. And sometimes a big concern is about concussions with youth. And for a lot of parents who may not know, what exactly is concussion? A lot of times we think of brain.
Yeah. So concussion is basically your brain moving inside your skull, kind of like an egg yolk in an eggshell. So either a whiplash collision or a helmet-to-helmet or a head-to-head hit can cause that brain to move inside the skull, and that's inherently what causes the injury.
Are there different levels of severity with the concussion?
We used to think it was kind of a 1, 2, 3 grading scale. We thought if you lost consciousness, for example, it was worse than not. That's all gone away. We now just basically call it black and white. It either is or it isn't. And
you talk about, maybe losing consciousness. Is there a way to have a concussion without necessarily losing consciousness?
100%. Yeah, absolutely.
So what should they be looking for?
What we tend to educate people on is kind of signs and symptoms. So if your child appears dizzy, balance problems, headache, fatigued, things that you can observably see, things that they will feel are kind of some fogginess, problems with thinking, concentration, attention, memory problems, all of those should raise alarms to concussion.
And you were talking a moment ago, again, you would probably immediately think of football, for example, taking a lot of hits to the head here. In order to get a concussion, is it usually got to be some kind of direct hit to the head?
It doesn't always have to be, no. I mean, we could easily get a concussion in a car accident, which our head never hits anything. So just simply that whiplash motion can cause enough force for that brain to move inside the skull. So
if a parent is starting to maybe pick up on some of these symptoms here, what do they do?
Typically, you can follow up with any medical provider. Oftentimes, emergency rooms kind of want to have that in and out quick approach. We have a clinic at Tallahassee Orthopedic Clinic, which is seeing concussion all day, every day. So we certainly specialize in the injury. Obviously, for further outlying areas, you may go see a primary care doctor, something like that. But there are specialists available if symptoms continue to linger.
What's the treatment typically like? You got a 16-year-old, maybe they've got a concussion. So, what kind of, prescriptions or whatever would the doctors?
We're using a lot of really new treatment approaches, things that are pretty novel. We use a lot of physical therapy. We give them academic accommodations for their school environment. We get them working out. We use medications. It's pretty interesting stuff.
Kind of retraining in there too. Also want to ask here too, is this something where treatment, it kind of goes away, or is there a possibility that there may be other lingering effects with the concussion?
No, we tend to think that if you treat it, it's gone. Cows are back in the barn, they're back in the barn.
Okay,
so that's kind
of a good analogy with it there.
We want to treat it, get kids back on the field safely, which is our goal.
And a lot of programs too, Leon County's really stepping up with a lot of their safety initiatives with sports and in high school sports specifically. With parents, as they get ready to sign up their kids for different activities, what's the best warning or the best message for parents and youth safety? Yeah,
Leon County's done great. I mean, from their entire school support staff on the medicine side, they do baseline tests. So prior to the season, you can get an idea of what is normal cognitive functioning. So then if the child does sustain a concussion, there's a comparison there available, which is a huge step. There's not a lot of counties around the country that have invested as much as Leon County has.
Good advice there. Dr. Scott Burkhart, thank you very much for joining us here this morning. Great advice for parents. Of course, we have all this up for you on the Sunrise section of our website, WTXL.TV. Don't go away. We're talking